The Kroh Center was established in the mid-90s. It really served as a state-of-the-art center at the time, and over the past 20 years, the field of gastroenterology has really expanded. Our volumes have increased by more than 15 to 20% per year. Our patients have gotten more complex, older, more sick, and they need a unit that really attend to those needs. And we've also expanded the types of procedures we're doing.
Endoscopy has been used to diagnose and treat disorders of the GI tract, but we also have discovered that it's very useful as a screening tool. Since 2000, that screening technique of taking normal people without any symptoms who are age appropriate or family history appropriate would allow us to screen them, identify polyps, remove them through the colonoscope without needing any surgery, and reduce the risk of colon cancer.
The majority of what we do is colonoscopy screening, endoscopic ultrasound, we do ERCP, we do stent placement for a lot of our patients that have cancer, as well as anorectal manometry for our pelvic floor program. So we really cover the full breadth of gastroenterology in our center.
Patient privacy is one of the biggest challenges that we have in our center. We have 15 prep and recovery bays, and unfortunately they're only divided by curtains. So we have to be very conscientious of our tone of voice and how loud we're speaking because we're dealing with delicate information. We don't have the space to accommodate the families as much as we would like to. We would love for the families to be able to be a part of the entire process. We really want to standardize our procedure rooms. We're not able to do that in our space right now. This is to make sure that we are providing the most effective and safe care for our patients. We looked at these challenges a few years ago and we started to see how much we were progressing and how busy we were, and we wanted to make sure that when we were planning something, we were planning something correctly. So we knew that we needed a new center. We knew we needed to be able to accommodate the community and the other physicians from our community, not just our employed physicians, but the other physicians. We also knew that we needed a space for our patients so that way they had the best experience possible. We use something called a 3P, which is production, preparation, and process. And with those tools, we then take a multidisciplinary approach. So with the 3P process, you literally create the room. So this is one of the rooms that we created. So this is what we had down on our plans, on our piece of paper, brought to life to a real life visual. This is to scale.
This is one of our therapeutic endoscopy rooms. We have separate workstations for the physicians, for our cytopathologists, as well as our nurses. And we've really studied the proper flow for patients to come into the room as well as exit out the back doorway.
As you can see behind me, we have the prep and recovery bays. It is much larger than what we already have pre-existing. We have where the patient will stay. The patient's continuously monitored during recovery. We have our peekaboo area, so that way the nurse can monitor two patients at the same time. We also have our nurse workstation area here, so that way the nurse and the patient are able to sit next to one another and have a conversation.
So an exciting new addition to our center is building a suite for our interventional pulmonologists in order to do advanced procedures such as interventional bronchoscopy and endobronchial ultrasound. This will enable our patients to receive more advanced care in diagnosing and potentially even treating lung cancers and other cancers of the chest cavity.
At the time we were looking at this particular project, Sharon Barnes was the president of the Volunteer Auxiliary Board. We thought that the Kroh Center was important because many of us have actually been in the old Kroh Center, and it was clearly in need of updating, and there was clearly a need for new capacity to meet all the patients that were coming into the center. The $1 million that we gave for this project is one of the largest gifts that the Auxiliary Board has ever given, and that tells a little bit about how important we think this particular project is.
Our new center will really attend to the needs of the growing field of gastroenterology, attend to our patients' needs and privacy issues, and also think about the future and new technologies that are brought into our field.
Having seen the growth of GI over the years, this is a very exciting time, new frontiers, and that's been the tradition here at GBMC. That when a new technique or a new medication becomes available, we've been one of the first adopters to that technique to make sure that we utilize it and can provide it to the patients in our community.
Ultimately comes down to the patient and the patient experience. From the minute that you enter our new digestive center, we feel that you will be comfortable, attended to.
Safe, professional, friendly, sensitive to patients' needs, enhanced privacy, enhanced cleanliness, and we think that's the way into the future to provide the kind of care we need to meet the community's needs here at GBMC.
We are really excited to get this project completed by the fall of 2018, and we really appreciate the community's support in achieving this endeavor.